Assalamu alaikum. My name is Ida Fatma. My roll number is BP1650186, and the topic of my presentation is rational and irrational use of fluorouracil. There's a brief introduction about this drug. The brand name for fluorouracil is Edrucil, and there are other names such as 5-fluorouracil or 5-FU for short. Fluorouracil drug class is anti-neoplastic or anti-metabolite. The indications for the use of fluorouracil include colon and rectal cancer, breast cancer, and gastric cancer. Now we will see the mechanism of action, how fluorouracil works as a chemotherapeutic drug or as anti-metabolite. Fluorouracil is an analog of uracil, a component of ribonucleic acid. Now it is believed to function as an anti-metabolite because after intracellular conversion of the active deoxynucleotide, it interferes with the synthesis of DNA by blocking the conversion of deoxyurodylate acid to thiamidylate acid by the cellular enzyme thiamidylate synthase. It may also interfere with RNA synthesis. So, in short, fluorouracil works by interfering with RNA and DNA synthesis. The dosage for fluorouracil for adults is 350 to 525 mg 24 hourly, and the route of administration is intraarterial. For pediatric, the dose is 6 mg per kg as recommended, and the route of administration is intravenous or IV. There are several side effects of fluorouracil since it is a chemotherapeutic drug. The severe side effects include loss of appetite, headache, vomiting, diarrhea, mouth inflammation, hand and foot syndrome, itchy skin and rash. Leukopenia is very severe, low white blood cell counts, hair loss, sensitivity of skin to sunlight and photosensitivity, and much more. The rational and irrational use of drug. For the rational use, 5-fluorouracil was first introduced as a rationally synthesized anti-cancer agent 30 years ago, but it is still continuously be used in the management of several common malignancies, including the cancer of the colon, breast, and skin. Fluorouracil is also used as a cream for actinic keratosis, basal cell carcinoma, and skin warts. The irrational use of fluorouracil can cause significant health problems in the current medication. Since the marketing, distribution, prescription, and use of fluorouracil is defined in WHO guidelines, if we do not follow these guidelines, it can cause significant health problems since it has many side effects. The irrational use of drugs, or in particular fluorouracil, can be due to self-medication or irresponsible prescribing of the drugs. The drug-drug interaction, meaning the interaction between the fluorouracil and other drugs. This includes metronidazole. Fluorouracil, when used together with metronidazole, can increase the blood levels or add to the side effects of fluorouracil. It can also cause extreme fatigue, easy bruising or bleeding, black, bloody or teary stools, fever, sores in the mouth or throat, vomiting, and diarrhea. There are many other serious interactions of fluorouracil, which include with the adenovirus types 4 and 7, germanium, influenza virus, trivalent, adjuvanted, pelifermin, and tofacitinib. There are alternate brands available for fluorouracil. If you do not find Edrucil, you can use Pharmauracil by Pharmedic Private Limited. The price is 42 rupees. You can also use Curacil by Shafaz Pharma International Private Limited. The price is 56.16 rupees. Or you can use Fivoflu by Atco Laboratories Limited. Price is 50 rupees. Now there's a case study for the use of fluorouracil. The case is patient DN is a 48-year-old female in good health. She was recently diagnosed with breast cancer. The pathology report indicates invasive lobular carcinoma, high risk, grade 3, and the tumor size is 2.5 centimeter. But there is no lymphovascular invasion. Estrogen and progesterone receptor positive, HER2 negative. DN has had a mastectomy and is scheduled for cancer treatment, that is chemotherapy. She arrives in preparation for treatment. So we have to suggest her treatment. Now we will look at the soap notes. The subject is the gender is female, DN is 48 years old, the chief complaint is breast cancer, and the symptoms are invasive lobular carcinoma with a tumor size of 2.5 centimeters. Now the object is DN brings her lab reports which show that WBCs are 5.3, bilirubin 12, creatinine 55, GGT 29, HGB is 120, alkaline phosphate is 93, platelets 320, and AST is 35. Assessment. We assess that DN is less than 60 years old, that is 48, with high risk disease and no lymph node involvement. She is in good health and does not have any significant heart disease, an exclusion factor for this protocol. Now we have devised a plan for DN. DN has no previous treatment for breast cancer. Her first treatment cycle we will start will be epirubicin, that is 165 mg IV, fluorouracil 825 mg IV, cyclophosphamide 825 mg IV. We will prepare and administer as per protocol, that is following sterile techniques and safe handling procedures for hazardous drugs, because these drugs are chemotherapeutic drugs and they are very hazardous and have much side effects. Epirubicin and fluorouracil are dispensed in a syringe and given as IV push. Cyclophosphamide for IV infusion is dispensed in a 100 ml normal saline mini bag for doses less than or equal to 1000 mg. In addition, if the patient develops febrile neutropenia while on this protocol, there is an option for the patient to start filgrastim GSP to treat neutropenia. This is the first chemotherapeutic cycle for DN, which completes here. Now, DN will receive her second, third, and fourth chemotherapeutic cycle as per her doctor's recommendation. Thank you.